and a very happy morning to all of you. And here you are on my show Monday Mornings with Mansi and my YouTube channel Dr. Mansi Shah. Friends, today we are going to speak about wisdom. Wisdom? No. Wisdom tooth, which is commonly called as third molar, अक्ल दांत और सबसे last वाला पीछे वाला दांत, the last most tooth. So this last most tooth is called as wisdom teeth. Why? Because they erupt in the age where you get the maximum wisdom. It is what the tale says. That is at the age of 15 to 21 to 25 years of age, you start getting that tooth. So all the other teeth in the mouth, they erupt till you're 12 years. The wisdom teeth or the third molars start erupting after the age of 17. So do this wisdom tooth really help us in chewing? Yes, they do help us in chewing. Ancestors did have third and even fourth molars erupting in their mouth. As the evolution has started taking place, our jaw size has started reducing. And so the capacity to accommodate many teeth has also reduced. We looked something like this earlier, where our jaw sizes were quite huge and large like monkeys. But now they have started receding, they have started going back. Hence, to accommodate this wisdom tooth, it is really difficult at times. Many of them have room for it, many of them don't. Now the main question lies is what is to be done of this wisdom tooth. So friends, the wisdom tooth can be there in your mouth if they are causing no trouble. But if they are causing some trouble or your oral health is at risk, then they definitely should be removed or extracted. Can a wisdom tooth have any other treatments? Few doctors do suggest root canal treatments for your wisdom tooth, and they do perform it also. But the success rate of the root canals is very less on the wisdom tooth, and the anatomy of the tooth is also very difficult to get them treated. The best thing, if they are causing any trouble in your mouth, it is to get extracted. Now you have four wisdom tooth, upper two and lower two. The upper ones are always much more easier to remove. The lower ones are a little complicated, a little difficult to get them removed. You don't have to be scared. A skilled oral surgeon or oral maxillofacial surgeon who is expertised in removing all this teeth might just help you. And he is the best person to get your wisdom tooth removed. What are the risk factors that are associated with your wisdom tooth? Now, if the wisdom tooth has sufficient space to come up, they will properly come up and just take up the right position. But if they don't, then they might just, come inside, they come outside, near your cheek, outside your cheek, near your tongue, or sometimes they can be front and back also. If they are in front, they might just impinge the other teeth and cause crowding in your mouth, or if they are back, then it might impinge on the bone behind. So the position of the tooth is also very much different. Now there are some tooth which are just be inside the bone, like vertical, or some which are horizontal, but only the skin portion is covering the tooth and it has no more room to come out. So all these positions, different positions, can cause different risks. Now if you had undergone some braces treatment earlier, then if the wisdom tooth is about to erupt, then it might lead to crowding. That is, all the straightened teeth might just suddenly crowd up because there is no space, and that wisdom tooth is causing pressure because it has to come up. Then if the position is not right, inside out or upside down, whatever, then sometimes, because this is a tooth and this is the wisdom tooth which is given it an angle, there is a lot of food lodgement that takes place, and a lot of food lodgement means an invitation to caries, infections, bacteria. It is not only the wisdom tooth that has cavities, but it is also the tooth nearby which gets the cavity. So hence it is very much recommended that you remove that tooth off and create an empty space so that no food lodgement takes place. Now there is one more thing that takes place, is pericoronal flap. That is, in simple terms I'll tell you, the tooth is just lying down there. There is a flap which is covering the gums which are covering the tooth. Now it has formed a pocket. Now this pocket becomes source of a lot of food lodgement. Then as there is the pocket increases, more food lodgement takes place, the upper teeth impinges on it. It just hurts it, and there is swelling of the gums and bleeding sometimes. There is halitosis, that is bad breath that you can suffer because of this thing. Now in certain cases, just removal of that pocket or the flap will help, but in many cases removal of the tooth is advisable. Now if the tooth is asymptomatic, there are no caries, no cavities, you are able to maintain it properly, floss and brush properly, then there is no need to undergo removal of this wisdom tooth. It is just doing fine. But if it is there any other risk factor associated, then it is always better to get it removed. Now coming to removal of the wisdom tooth, is it really very much painful, or should you get scared of it? I would say no. Wisdom tooth removal is same as removal of other teeth that in your mouth. Like a local anesthesia is given. This anesthesia numbs the tooth. Your dentist with some instruments removes the tooth easily. In certain cases you might require stitches, that is 1 or 2, and the work is done. Now people are like, oh my god, injections, instruments, anesthesias and stitches. That's horrifying, right? No, it's not. Don't you worry. It is just a procedure of 10 minutes to half an hour maximum. In the cases of surgery, if it is required, the dentist will obviously inform you priorly what exactly is going to happen. So you don't really have to take tension about it. Just relax, sit back, give your dentist a chance, and he let him or her do the job. So this is how wisdom tooths can be a headache or they can be a blessing. It all depends on how the mouth structure is and how your anatomy is, etc, etc, etc. So don't you worry, just stay smiling and be happy. Wishing you all a very happy and a brighter smile. If you're liking my videos, do not forget to like, comment, share and subscribe to my channel, Dr. Mansi Shah. Stay healthy, stay happy and stay over fit. Thank you.